The easy model. So in our girl, so we're going to have our mons pubis. This represents basically the clitoris, internally and externally. Labia majora is the outer lip. Labia minora is the inner lip. Then you have urethra, first tube, vagina, second tube. Anus is missing. So then on this model, if I correspond the two, so mons pubis, this is the clitoris with clitoral hood. Labia majora, labia minora, urethra, vagina, anus. So then if I compare some more, vaginal rugae, one of my favorite words, the ridges, then this would represent the cervix area. So the cervix is the tunnel, basically, into the uterus. But now there's fornices, which are the V's. So you have an anterior fornix, which is the kind of the cup to the front. The posterior one's to the back. There'd be two laterals, which you can only see by looking head-on. Then I have my external os, which is the outside entrance to the cervix. I have my internal os inside. And this is my uterus here. And I have my endometrium, which is the innermost layers, my myometrium, which is the muscle layer, and my outer, which is the perimetrium. So in this one, endo, myo. And then the endo on this model is separated again. So the innermost is going to be the stratum functionalis. That's the one you menstruate and implant into. The one that's reddish and below that's the stratum basalis, just like in the skin, that makes that layer. So functional layer, basal layer, both are endometrium. Then, because your uterus flops around, it's got spaces. So the back space here is the rectouterine pouch between your rectum and your uterus. The front one, which is here, is the vesicouterine pouch between your bladder, which is a vesicle, and your uterus. Then the uterus itself has a body and a fundus, which is the floppy part like in your stomach. Then if I tip up or right here, I have my fallopian tubes or uterine tubes or oviducts. They go around, there's an ampulla, the isthmus, and then the fimbriae, which are the fingers, which go on the ovary, which is right here. The ovary has a white part, which is the tunica albuginea, same as the testis. Right? Then I have to do my ligaments and whatnot. So the problem with ligaments is they're all over the map. So if you go from the uterus forward to your pubic bone, those are called the round ligaments, which are here. On this model, it's here. And on this model, it's basically here and here. Then if you go sideways to your ovaries, those are called the ovarian ligaments, which would be here and here, or there. Then you go back to your butt, basically, uterosacral, which are these two here, going to your sacrum, or this one here, or they cut it off, but it's this one here. Then it's sitting in this broad ligament. This is what's called, that's the yellow here. This is the broad ligament here, all this tissue here. Or this one you can actually see the broad ligament that's sitting in. And that's broken down into three. So the mesometrium is the part next to the uterus. So mesometrium there, here, and here.
Slower.
Okay. Here.
Yeah.
Here.
Okay.
And here.
Okay.
Then you have the mesoalpinx, which is between the fallopian tube and the ovary, which would be here, kind of there, and kind of there. The only one that's missing is mesoovarian, which is on the ovary itself, which on this model is shown as this little depression here. This one, honestly, I don't think shows it very well. And this one doesn't show it very well either, but it's this little wrapping on the ovary. So all those would form the basket the uterus sits on, with the other ones going to each side. Then, that leads us to tissues. So,
shine on that thing.
Uterus. You're going to know a uterus because it has the squiggly worms, also called uterine glands formally, in it. So you have a lumen, you have all these little lines, and then the bottom would be where the muscle is. This is the myometrium here. The endometrium is there. And the endometrium is broken down into two. So if you look kind of with your eye, there's sort of a difference about here. So functional layer, I'm going to say, is more up there. Basal layer is more down here. Then I have a fallopian tube. Fallopian tube is going to look like kind of like a star, snowflake, depending on who you talk to, and it has some muscle, but not as much muscle as the vas deferens did in the male. So it's not nearly as muscular. And then vagina, we don't have a picture of, but that would look just like an esophagus, just with some differences. Stratified squamous epithelium with some glands and whatnot.
More blood vessels.
More blood vessels, a little bit more weighty. Then we have to do breast tissue. Let's find some boobs.
It's right over there.
Bring me your boobs. That's it. All right. So, we'll start on the easy ones. Nipple and the areola is the colored ring. Then, if you think of this as like a lung, it makes some sense, but the whole thing would be a lobe. So, lobe, lobe. I'm saying there's 3 lobes I can see. Then each lobe is broken down into like mountains. So, lobule, lobule, kind of lobule, lobule. And then each of those is broken down into a bump, an individual sac. So alveoli. So alveoli are the individual bumps on the lobule in the lobe. And those drain down the lactiferous duct, which you really can't see, but the lactiferous duct comes out right here. And those are your lactiferous sinuses, which are just before they come out the nipple.
So it's like a backwards volcano.
It's like a backwards volcano. Or it is a volcano.
Yeah.
Strong.
Great.
Yeah.
That's a bad
So this
mental
one's
image.
yes.
2 volcanoes.
2 volcanoes, yep. Okay? And this slide, I don't think we have.
What about the poster over here?
Oh! I always use the girl poster over there. That's the only one that shows the external picture.
Here, I'll put this for you.
But we can also see some other things that aren't on the other models. So for example, we can see the lateral fornices, where the vagina forks to the side of the cervix. This also shows the osses pretty well, the external, internal, and the crypts. And then, let's see, this one kind of shows a little more detail on the fallopian tube. So the fimbriae or the fingers, the ampulla is kind of the corner, the isthmus is basically the tube itself. But on most of the models, these all sort of blend together. But there is a difference in their name. This also shows the suspensory ligament, which is on none of our models that I'm aware of. But that's one that's going to hold your fallopian tubes up in position, which is not shown on the models. But the main thing that you want to focus on this poster is the external vulva shot. This shows you the external one. So we have their clitoris with a hood or prepuce. We have our minora majora. There's a crus to it, but you can't see it on the models. But there's a V that it forms. So you have majora, minora, vaginal urethral orifices, clitoris with hood, mons pubis, pudendal nerve, pudendal triangle. I think that's it.
And then the graph, are we going to need to know that for...
Yes, that'd be good for your lecture part, is knowing the menstrual cycle graph, which thou shalt know for your exam. Next week, thou shalt. Draw this poster on your exam.
We can do that.
I can do that.
Is that it?
That's all. Pretty sure.
And you'll be posting that?